Recording. Okay. Go into. Maggie on Zoom. Can you hear everything okay?
Maybe.
Yes.
Okay, cool. Just making sure.
That's fair.
Oh, you mean the phone? I mean, it'll have the recording of my sound. If that's what you're wondering, or what are you trying to figure out?
The iPad doesn't want to turn off. Actually, though, that's why the volume off, so it might be.
Hearing the voices coming through. I'm not getting any nasty feedback, so I think it should be okay. Okay. A small group today.
Better than nothing.
It's better than no one showing up.
We'll take this.
Yeah, because music therapy basics weeks was sad.
Oh no.
So sad.
It was just me and Jocelyn.
Yeah.
Oh no.
And I was like, I prepared this presentation for people.
That's sad.
And looking at it, it was literally the officers and Mel.
Yeah.
Minus me and Rachel, we didn't come officers.
A little better to sleep. Okay. We'll just go ahead and get started because I think this will be about everyone that we'll have today.
Okay.
So, welcome to MTSO, everybody. Little change of plans from our original schedule. We originally were going to have a Jan session today, but awesome opportunity came up with Sara here on Zoom, and she agreed to speak to us a little bit. She has a volunteer opportunity for seniors and second-year grad students. So yay for volunteer opportunities and get involved, but I will turn the rest of the time over to Sara as much as you would like to take.
Awesome. I'm sorry I'm taking your time out of your jam session. Gosh darn it.
It's all good.
Oh. There's 4 of you, 1 on Zoom, 3 in the room. Is that correct?
There's 5 of us. There's 4 in the room and 1 on Zoom.
Oh, hi, I see your hand. I'm just making sure. This can be super casual, y'all. I have like a little what I do in the hospital if you're interested, but if it's uninteresting or if it's not something you want to hear, tell me to keep going. On the opposite end, if it's something you're really interested in and you have questions about, feel free to ask them. You don't need to wait. You don't need to do anything. Just let me know. Does that sound okay?
Yeah, perfect.
I also want to know, like, what kind of learners are y'all? Because I have a PowerPoint I can show you if you want to read along, or I can just talk at you. What's better for everyone?
I personally like a visual.
I do as well.
So
Okay.
visual winning. So let me just make sure that you can share your screen really quick.
Thank you.
Okay, you should be good.
Perfect. Okay, let me do it. Desktop 1. Okay, 1 second. I have to open my security preferences because I'm using a different computer than I normally do. Zoom. It's gonna make me quit and I'm gonna be right back. Give me 30 seconds. Oh, maybe it's not.
Hey.
Nope,
Nope, it did. Oh, now we get to see our cute faces.
She's from Phoenix Children's. Do you think it was okay that I tagged them?
I will.
She's waiting to be let in.
I will let in the preface while we're waiting here that the volunteer opportunity isn't through Phoenix Children's. It's a separate event. So, but she.
Okay, sorry about that.
Okay, cool. There we go.
I'm back. And you can see my messy office. So sorry.
There we go.
On video spotlight.
Desktop, this. Perfect. All right. You guys see that?
Yes.
Amazing. I'm going to be talking to y'all about transitioning into the peds space. I'm a new peds music therapist, but also transitioning in. And then I think of my job about helping people transition. It's how I kind of frame what I do. So ask questions if you will, but just a little background about me so you know who's talking at you. My name's Sara Jane. I use she, her pronouns, and I graduated from Belmont University, which is in Nashville, Tennessee. So I was a part of like their third class. It's a very new music therapy program. It's wonderful. Love it. I was like one of their third or fourth graduating classes there. I'm a voice principal. So I use my voice mostly, but you know, as we all do, I learned all of the instruments. And now I kind of play everything every day, whatever anyone wants. My internship was at Nationwide Children's Hospital, which is in Columbus, Ohio. Love the internship. Ever have questions? Feel free to ask. It's amazing, and they let you experience so much within the hospital setting. All of these things and more. I was in the NICU, PICU, HEMONC, all different ICUs, whether it be the CV ICU, the pulmonary ICU. They have an intensive rehab for pain program. It's wonderful. I don't know if I put hospice on there, but I also did a pediatric hospice rotation. I saw everything and it was wonderful. And it was during COVID, which was wild, and helped me a lot, truthfully. So that's great. Before I came here, I was working at a nonprofit called Voices Together in North Carolina. That's a different conversation, but I worked primarily with autistic teenagers and community members, working to promote psychosocial education and self-advocacy within those individuals. And now I'm at Phoenix Children's, which is why I'm here talking to you. So just so you know a little bit about how music therapy works within my hospital, within Phoenix Children's, there are 2 full-time music therapists. We don't have anyone part-time, so it's literally just the 2 of us covering this entire hospital, which is wild. Yes, we kind of split up the hospital so that we can prioritize who sees who. Cindy, the other music therapist, her primary units are the NICU and the CV ICU, so the heart ICU. I primarily cover the HEMONC unit, so that's hematology, oncology, which is cancers and blood disorders, as well as the PICU, so the ICU, the pediatric ICU, and the rehab unit. They gave me rehab because I've experience with it. I'm not NMT trained. That's something I'm looking into, but just if you have questions about that, I cannot help you, so sorry. We're consult based, and this is simply because we cannot see every child that comes through this hospital because there are 2 of us and it's physically impossible. So not everyone gets us. We're consult based. Most of my consults come from either nurses, the palliative medicine team, or the child life team. So those are kind of who want, or psychology also. So between those people, they'll put in a consult into our computer. I will see it. If I have questions, I'll call them and be like, what do you want me to do with this person? But usually they're pretty good. And they're like, we want you to work on coping skills. We want you to work on end of life. And they tell me why they're asking me to go see them. Goals I'm commonly addressing, these aren't specific goals, these are more goal areas, but anything from normalizing the hospital because it's a scary place, especially for a child, working on anxiety and lowering that anxiety so that they can heal and kind of get some rest that their body needs, continue to build or just address the lack of positive coping tools that they have. Always self-expression, trying to get children and their families to kind of open up and express themselves if verbal language is not something that they're totally comfortable with. I'm often seeing patients and families on legacy building. So that could be at the end of life, where I'm sure y'all have heard of heartbeat recordings. I do a lot of those and things of that nature at end of life. I also do legacy building throughout the entire time, especially if you have a long hospitalization. It's hard to build milestones within this because it's not somewhere you want to be. But I think it's important to be able to notice, like, this is the first time I could eat on my own without my tube, or this is like the song I wrote when I could stand up for the first time and actually walk to the bathroom, like those little moments, and creating a legacy and kind of reframing what it is to grow up when you're in a hospital. I also do procedural supports. I also do pain management. I also promote bonding and relaxation and helping them maintain their state. So like staying asleep once you fall asleep, or staying awake once you're awake, things like that. And also supporting development. I do a lot. The hospital is wonderful because you can never be bored. Because one, you're always needed somewhere, and two, you very rarely do the same thing twice. So that's why it really works for me, but it's not for everyone. And I recognize that. And within every session, it involves helping either the patient or the family transition in some way. That's how I frame my work. It could be transitioning from awake to asleep. It could be transitioning from sitting to standing. It could be transitioning in moods. There's always something happening. There's always a transition, and that's how I kind of frame what I'm doing so that I can better plan, because it's such you don't know what's going to happen. You kind of got to be on your toes. So just paying attention to those transitions helps me stay grounded as a therapist. And that's kind of how I plan out my day, how I plan out where I'm going and what I'm doing once I'm in a room. Cool. Awesome. So I brought a couple case studies to y'all, no patient identifying information, but I thought if you want to, I could kind of present the case to you. I'm happy to tell you what I've already done with them, or if you have ideas, I'm always up for new ideas. And I think this could be a cool brainstorming session. Like, what would you do? Because there's no right way to do music therapy. There are wrong ways, but there's no right way, right? So here we go. We're going to start with someone who we're going to pretend we just met them. This is the very start of their treatment. It's a 3-month-old baby, and I'm meeting them in the PICU. So that's the intensive care unit. It's an intense environment. They're all glass doors. You never have any privacy. There's beeping constantly and people running in and out all the time. This baby has something called LCS, which is Langerhans cell histocytosis. I always say it wrong. It's similar to a cancer, but it's not a cancer. He has excess cells in places where they should not be. And that's causing him to also be diagnosed with failure to thrive, which, if you don't know, is when babies aren't gaining weight and they aren't able to grow as they need to. And he has also just gotten a partial gastrectomy. So he's post-surgery, not feeling great, pretty sedated. He's on a ventilator, so he has breathing support, and he's sedated, so he's not going to be waking up for our session. I was consulted. Someone called me and said, hey, I need you to go into this room and help the mom. Okay, mom is bilingual. She speaks Spanish and English. She's married, and she has a 2-year-old at home, so she's the only one in the hospital because her husband is at home with the other child. And she tells me, I like all music. And I was like, okay, do you have any favorites? And she's like, yeah, I guess my favorite is Bad Bunny and Adele. So this is kind of what I walk into. Wondering, you do not have to talk. I will not force you to. This is not a class, but do you guys have any ideas, like what you might want to do or what you would want to try?
Sarah's reading it again. We have a Sarah Rabbit here who's reading it again. So
Good job, Sarah.
Ideas.
I don't expect y'all to be like, yes, this is exactly what I've done in my practicum, because this is a very abstract idea.
How about a acapella with the beat, Leave the Deep by Adele? Kind of like feeling of like life is happening and it's heavy all the time.
Yeah, I like that idea, kind of creating that active music and getting the mom to engage with something else rather than staring at baby and kind of being like, I'm so worried about my child, which is valid. I'm also worried about your child, but kind of getting her mind off of that, engaging in active music. I love it. I love it. Anyone else got ideas you want to share? It's okay. You don't have to. I'm sorry. I'm totally putting you on the spot.
No, it's all good. I think this is new for a lot of us.
Yeah.
This setting is very new for all of us.
I understand that. Yeah. Okay, and this is also like a hard case. I think sometimes when you're with a baby, our go-to is like, I want to make the baby make music. That's what I do. But in this situation, when I walked in, the mom was very upset and very worried, which again is totally understandable. And I went in and asked her what she needed, and she said she wanted to help getting distracted, and she also wanted to feel more normal. So we did do some active music making, exactly kind of like what you were saying. And I also focused on making sure that I was giving her tools to use when I was not in the room. Okay, so I'm gonna exit out of my presentation for just a second so I can see your faces. So what I did is I went into that room and we focused on grounding techniques using music that she already likes. So these might be familiar to you, but let me, like some of the ones that I love, one of my favorites is I find music that they already like, and I ask them to count how many times in a song they say a specific word. So I think I used an Adele song. Someone Like You. Is that an Adele song? Or am I thinking? Okay, yes, it is. Perfect. So let's say we did Someone Like You. I pulled it up on my iPad and I said, I'm going to do this with you right now. I want you to focus on nothing else, but we're going to count how many times Adele sings someone. And so we go through the entire song and it forces her to stay grounded, stay in the moment, so she can't think of anything else. And we progressively get harder and harder. I do this enough that I know, like, the hardest song I've ever done this to is, oh, I can never think the name of it. It's the Beatles song, the love, 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 love. They say love like 172 times in that song, and it's so hard to count. So we did that for about 30 minutes. I also went in with her and we sang to her baby. And that was really emotional for the mom. It was something that she had not done. And we sang to her baby and we sang familiar songs that she knew, both in English and Spanish. And then I gave her a little assignment to do. And because I try to give parents and children as much choice and control as I can when I'm in their rooms, but this mom was so distraught, so upset that I felt as a clinician, she needed some direction to go on. So I told her, I'm going to give you a piece of paper and I want you to write a letter to your baby. I want you to write a letter about everything you're hoping for them, everything that you want to see for them in the next week, 2 weeks, and how you're feeling right now. And then after she had written that letter, the next day I came by, I took the letter and we created a song out of it. And that's something that we then recorded and we used throughout their hospitalization. Okay, so my goal in that moment was to help her transition from a completely frazzled state into something where she could focus on bonding and working with her child rather than just being worried for her child. And as this baby's kind of hospitalization continued, they did get better. They ended up going out of the ICU and we started to transition to focus less on the mom and more on the baby and on their development. And I was kind of teaching and coaching the mom, like, this is how I'm using this song to do that. We can help move their arms to midline. We can help them calm down by singing this song. Remember the song you wrote? We can use that. So that's just kind of one example. We started with treatment and it continued the whole time and it was wonderful. Okay. Is it okay if we do another?
Yeah.
How
I'd
long
love
was
to.
that particular child in the hospital? Like how?
Oh, great question. They came in when they were 3 months old and they left when they were about maybe 6, like 3 months in the hospital.
6 months, 3 to 6
Yeah,
months?
around 6 months. It was a long time.
Is that about average for a client for you, or is that really short or really long comparatively?
Yeah, there's a wide variety because I cover both PICU, which is usually intensive care, that can last 1 or 2 days.
Okay.
Sometimes if you are in the PICU and you need extended care, I see you for 6 months, 8 months. Yeah, it depends, because the longest term patients I see are usually my BMT friends, which is bone marrow transplant, which is part of some kind of cancer care, some cancer cares, which is you have to have a transplant of your bone marrow. And those kids are usually here 6 to 8 weeks. Could be longer, could be shorter. So sometimes I need to see a kid in a day, and sometimes I have 6 months to see them.
Okay.
There's no average hospitalization, which is, I know, a hard answer, and I'm so sorry.
No, that's okay. I was just curious about how it is for you, how life is for you.
Yeah, I understand. Sometimes I ask those same questions. I'm like, could someone tell me how long this child will be here? Not often. Okay, let's go to another person. This patient I kind of met in the middle of their treatment. He is 19 years old. He's here for a BMT. So we're in the BMT admission. We know that they're going to be here for 6 to 8 weeks. He had 3 rounds of chemo prior to this admission, and his chemo had to happen inpatient. And so he was here for like 3 weeks. The first time he was here for a little longer for some complications, not important. He has a history of anxiety, pretty extensive anxiety, and also some substance use, which he obviously cannot happen at the hospital. He's self-taught on guitar, and he identifies music as a primary coping skill of his, which is awesome. His favorite music is all over the place. He loves Metallica some days. Sometimes he's like, yo, Death Cab for Cutie's really cool. Sometimes he's like, I want to listen to a Tribe Called Quest, which is New York rap. So he likes almost everything, and he's super knowledgeable about bands and guitarists. So it's not like, I like everything, I don't really know anything about anything. He like knows it too. So this is a friend of mine. Anyone have ideas on like what your go-to thing would do, or what you want to know? Would it work? I can give you some insight maybe.
My first thought was to do a songwriting activity with maybe a song that he already knows, maybe change the lyrics to something he wants to do, like, because he's already really familiar with the music. He knows guitar, so it could be like a really fun collaborative experience. Like, oh, what if we changed the lyrics of this song, or maybe we created a song that has the same chords that your favorite Metallica song has, or something like that, so that he could use that as a coping skill while he's getting his treatments and whatnot in the hospital. That was my thought.
Totally. I love that idea. Yeah, I think that would work really well. Get into the music for sure. Awesome. Anyone else want to throw out an idea? You don't have to. I'm sorry, I'm putting you on the spot.
Is he incapacitated where he cannot play guitar on his own? Like, is he able?
He can still play guitar. Yeah, there might be portions during his treatment where he feels a little bit too weak to do that. But at the beginning and end of treatment, he can play, he can walk around. He's doing fine. He is on isolation, so he cannot leave his room, but he can still stay in his room and walk around and play guitar.
Brought in an extra guitar. Most
Yeah.
can jam together. I think just that might even be
Yeah,
normal.
totally. Just focus on that normalization. Here's a guitar. I know you like it. You can keep this in your room. Yeah.
I think it would be cool to take one of the songs that he really likes and create a recording of it.
Okay.
Where he does the guitar, maybe he wants to do vocals, and you bring in like a shaker or like use some garage band to do some extra beats, and then he can listen to that and feel proud that like he recorded the song, did a cover of it. I don't know.
That's a cool idea too. Yeah, totally. Totally.
What about like picking out his favorite songs and do like a fill in the blanks?
Oh, say that last part one more time. I didn't quite hear you.
Maybe picking out his favorite songs and work on like fill in the blanks to work with anxiety.
Yeah, almost like a memory thing, like making sure.
Exactly.
Yeah, I like that idea. That's awesome. Totally. You guys are giving me great ideas because this person is actually still in the hospital and I'm dragging out a little bit. So this is great. Yes, let me tell you what I have been doing with him. So he's 19, like I said, and he is like our first couple sessions, he wanted to teach me guitar, which is amazing. That's not my primary instrument, and he's really good. And that gave him a sense of choice and control that was fantastic. So I went in and he was like, do you know One by Metallica? And I was like, I know the song. He was like, do you know the riff? And I said, no, let me bring you a guitar and let's learn it together. He was like, I don't need to learn it. I know it. I can teach you. Please teach me this riff. So that has turned into a thing, and that really helped me build that rapport with him. I think with older teenagers and really adults, young adults, it's hard to be in the hospital because they are just edging into this autonomous life where they maybe have a job, maybe they're going to college, and then it's all taken away from them and they're told where they can go, what they can do, what they can eat. and they have very little autonomy over their own body, which is almost excruciating for a 19-year-old, right? So that opportunity for him to teach me, that got me in the door, and we are best buddies like this for now. And now mostly what I'm doing is we have such a good rapport that I go in and check in with him. And if he wants to see me, he will tell me. And he very rarely wants to do interventions that I bring to him. So I can tell you what I've tried. We've tried recording projects. We have tried just active jamming. We have tried making playlists. We have tried learning more songs together. He gets frustrated because I learn with a music theory brain and he learns with an ear. So that is not compatible. And I'm like, okay, what else can we do? He's written songs and showed them to me, but is not interested in collaboratively writing a song. He is interested in, I have like a MIDI pad and a drum pad. So I bring that in, but he does not want to create music with me in the room. So that kind of forces me, right, to change who I am when I go into that room. I go in as a supportive presence, and I'm using my therapist body first rather than my music body, which I'm not going outside of my scope. He does have a psychologist, and I am not being his psychologist at all. I'm a supportive presence in his room, and I can speak the same language as him, which is therapeutic in its own way. And he can tell me, like, I feel like I'm listening to that playlist we created the first time rather than the happy playlist I did last time. And I'm like, okay, I know exactly what you're telling me. And you're telling me you don't want to be with me right now, and that's okay. So for him, it looks very different because my transition is more into how can I support you as a friend? How can I support you emotionally rather than how can I help you reach whatever physical goals you're doing? How can I help you reach whatever expression goals you're doing? So that's kind of the tough part of figuring out who you are in the hospital, because yes, your ideas are fantastic. And honestly, I might go try some of them today. But I doubt, like, he's probably going to be like, actually, do you want to watch Harry Potter with me today? And I'll be like, oh, I've got 10 minutes, let's go. So it's different every day. Those were fantastic ideas for sure. Yes, but yeah, he teaches me guitar, and that's kind of how our sessions have been so far. So
I'll take the lesson.
That sounds fun.
right? I know. I was like, hey, free lesson. I'll take it. I have one more, and this one has a song I want to show you, if that's okay.
Yeah, totally fine.
Share screen. Cool. So this is our last one, and I actually met her towards the end of her hospitalization while she's here. So she is 17 years old. She has a history of spinal cancer. It's non-curative cancer at this point, so we're doing more palliative treatment. She comes in not for curative treatment, but for comfort care when she needs it. She has been fighting cancer since she was 3 years old, so this has been her whole life. She knows the hospital like the back of her hand. She's been here through expansions. She knows nurses like their family. She has lived at this hospital throughout her life. She's post-tumor resection, a spinal fusion, and a steel fixation. So that means that she's had lots of spinal surgeries. She's got some hardware in there that's left her non-ambulatory. She's a full-time wheelchair user. And she also has developed chronic pain because of many different things, including the surgeries and the tumors that are non-operable at this time. Okay, so she has a really good relationship with her psychologist. And a direct quote was, she wants more than deep breaths and going to a happy place when she's dealing with her pain, when people are telling her to calm down, which is totally understandable. If you've been told since you were 3 years old, just go to your happy place when you are in pain. I get it. So they consulted me. I walk in, first thing she tells me, I love Taylor Swift. I said, good to know. Anyone have ideas like what you might try with her? I'm excited to show you what we did, but I'd love to hear from you guys too. Oh, I can tell you what goals I was working on. I didn't tell you. I'm so sorry. I was working on managing her pain. So not decreasing her pain level, because we know that's not exactly what we're working on, but her perception of pain. So decreasing that perception, also her emotional coping with this long-term illness, and kind of transitioning from curative care to palliative and more comfort care are where I was going with that emotional and physical goals.
I mentioned this for the last one too.
That's okay.
I also love Taylor Swift, and my first thought with Taylor Swift is she's a huge lyricist. She likes to write poetry and she likes to write out her feelings in song. Like you can go through her entire discography and find moments in her life that she snapshotted in songs. So again, I'd be like, maybe we could do like a lyric analysis of some of the things and find common themes that you really connect to, or even do some song writing of our own to kind of connect to that, using the song as a way to regulate through our emotions and to process those things, as an artistic form of doing that instead of just talking it out with a psychologist.
Yeah, that's a great idea. And you're so right. Taylor Swift has incredible lyrics.
You could also use that for legacy building, where she's transitioning from this is going to maybe get better to this is not going to get better.
Yes, totally. I think that's a great idea. Great idea.
I thought about the gait method. So having her actively participate in some way, even if it's just using upper body, clapper or something, to isolate that neural pathway so that it's not perceiving the pain so much.
Totally. Yes, of course. Great ideas. Yes, and I did actually all of them, and they worked really, really well with her. We did do some lyric analysis. Something to know, just put in the back of your mind, if you're ever with a Swiftie and you try to do lyric analysis with Taylor Swift, I think it's really hard for them to separate what they know she is talking about because they're such big fans and how it relates to their life. Like I struggled with that when I first met this friend because she knew exactly what Taylor was talking about. She's like, oh yeah, that's when she broke up with this person and he didn't come to her birthday party. And I was like, oh, okay. But like, if you didn't know what it was about, what do you think it might be about? And that didn't work very well. So we switched and she was very, very interested in writing a song for herself. So we kind of talked about like, what kind of song would you want to write? And she's like, I think I would want to tell my story. And I was like, what is your story? And she told me that her story was her cancer. It was what she had done with her life in the hospital. And I was like, okay, so tell me more. And we went through her whole life in the hospital and how it's affected her family, her friends, what people have said to her in school, how she's not really in school right now and how that has affected her. And then we took one of her favorite Taylor Swift songs, which is Willow, and we put those lyrics to that tune of the song and kind of did a piggyback, changed some stuff up. And she was there long enough that we were able to record it, and she did some MIDI stuff and she put her own thing. And then at the last minute, when we found out that she was really going to be going home in comfort care rather than any other treatment options, I introduced heartbeats to her. And I said, I know we have a song. Hear me out. We can record your heartbeat and then a part of you is in your song. And she loved that idea. She was upset and I was like, okay. And she did it all on her own, which was also really special. I was there next to her to kind of guide her and show her like, oh, that's like, if you want it to sound like that, you're going to press this button. Or if you want it to do like that, we're going to turn that up. But it was her song. She wrote it. She recorded it. And so it's, to musicians, you guys might be like, or an outside musician might be like, well, it doesn't quite line up. Like the heartbeat isn't always there. The echo isn't always there. That's okay. It was hers. And that's what was important to her and to me. So I have it and I have permission to share it with you if you want to hear it.
Yes.
Okay. Her song is called Scene and it is about her story. Like I said, where is it? There it is. So it's called Scene and it's about how she's seen in the world. Let me do this. So these are just the lyrics on the screen. Tell me if you can hear it.
Hear it. I'm gonna turn these up.
These old sin in your building. Always smiling, playing, I was happy. Now I'm crawling my skin. Wish I'd be home with someone else. Instead of seeing you fill my face with what I wanna say is no such thing. such confused, walking around this school, nowhere to turn. What I wanna say is no need to see whenever try the lessons. Time to listen to a word makes be better. That's my fast forward now to 17. Keeps coming back to me again.
Oh, there's a curse word, sorry.
Really fucking sucks. Feeling sick all the time. All of I always says no. What I wanna say is no one's the same. Whenever they try the last I've seen, I'm telling you, don't listen to a word they say. Be better, that's my plan. What I wanna say is I'm not the same. I'll try to make you see that I will not listen to what you say. I'll be better, that's my plan. I'll be better, that's my plan. I'll be better, that's my plan. That's my plan.
And that's her song. Whoops. So that was her song. And I mean, while it might not be like the best recorded song ever, it's gorgeous. I think it's fantastic. Sorry, I meant to warn you that there's a curse word in there because sometimes when you're dying, you have permission to curse as much as you want in my book. Yeah, do you guys have any thoughts, any questions about like that experience, what we did, why we did it?
I just really liked it. I thought that was really cool. It's interesting listening to it from like a student perspective, but also someone who's never had to experience like a serious medical condition, because you're just like, this is so sad. But then also at the same time, I was like, this is also so empowering and like taking power of that situation instead of just being like, woe is me, this is happening. Like, obviously you're allowed to feel that way, but at the same time, you could tell that she was just like, no, I'm like gonna take control of this. I'm gonna feel like I can do the most that I can do. And that's, I think, what makes me so excited about working in this field, is because you get to be a part of situations like that and get to witness people making those decisions and getting to feel that empowerment for themselves.
Totally. And you hit a good point that it's really hard to work in this specific, it's hard to work in our field. I think within it, there's specific sectors that you need to have a calling for, because not everyone should work in pediatrics. Like, it's hard. And especially if you don't, like, I had never experienced a childhood illness or a long hospitalization myself, and I've learned a lot from these families. And it takes a lot to put that humility forward and say, I don't know what you're going through, but I'm here to support you. And I know from an outsider, this is what I know, but tell me if I'm wrong. So that's a great point. Yeah. Okay. Sorry, I should have put like a warning at the beginning of this that I will talk about sad stuff. That's me. So sorry. I also feel like I get desensitized from it because it's what I do all day. So let me see what else. Yes, so we had her. She did great. Just a little bit on like hospital life. Is wild. It's really wild. It's I feel like in school we're often taught that everything is planned, and if you don't have plan A, you go to your planned plan B, and if that doesn't work, you also have your C session plan that you can pull out, and that you have like adaptation. So if someone does this exact behavior, you can switch and do this instead. That doesn't work in the hospital. Adaptation and change are your best friends. You got to be able to go in and be like, I think I'm gonna probably do this with the drum. And then if they start having a pain crisis, be like, never mind taking away the drum, let me totally just switch to another intervention that I know and I'm good at and I can do right now. Not saying you never plan, I'm just saying that plans often change. And being able to change with the plan is kind of your best friend here. You also like just being able to move around the space, because just when you think you're about to do a recording, often the doctors come in, or a sonographer comes in for an ultrasound, or things are never as you think they're going to be. Within the hospital, it's also really important to know your balance and kind of figure out what you're doing. So that's finding balance between you, the patient, and the music, finding the balance between the patient and their family, finding the balance between you and the nurse that just walked in and the attending that's waiting at the door, waiting for you to finish. Figuring out the balance between giving the patient all the control you really want to give them and finding the goal you're about to work towards. You got to figure out where you're going, and also balancing your different roles. Kind of like I talked about with our 19-year-old friend. He doesn't always want me in my music therapist role. Sometimes I'm balancing being his music therapist and being his friend. Sometimes when I walk into a room with a mom that I'm working on, I'm less of a music therapist, more of a coach for them, cheering them on, being like, yes, you did it. You sang the song that you were so scared to sing. Good job. Balancing when you need to be a supportive presence and when you need to push someone. So it's all a big, just kind of like stirring the pot and figuring out where you land. And that's also when you're not in rooms. When I'm walking around and I've got my giant music therapy cart and people are staring and asking questions and like, hey, can you come see me next? Hey, can you come see me next? Hey, when are you going to see me? Balancing that is also a big part of our job. And it's arguably, I think, the hardest part is I'm a people pleaser and I'm a therapist and I want to help everyone, but I cannot see 45 people a day. So I can't see everyone that wants to see me every day. So it's hard. Hospital life is not for everyone, but it's very, very rewarding. Post-discharge, a lot of my job, I'm often thinking about what can I do for families after they leave this. Not everyone has access to music therapy once they leave the hospital. This might be like 3 days that they're here for chemo, and it's the first time they've heard of music therapy, and maybe it's the last time that they'll ever see one, which is kind of sad to think about if you ask me, but that's another conversation. So I'm often trying to give them resources. What can they do when they're not with me? I could be introducing them to other music therapists in the area. It could be giving them playlists to use in their own times, kind of creating those resources that I can hand them and be like, hey, we kind of worked on this. If you want to do this, here's how I might tell you. These are the instructions I might give you. It's giving them tools to songwrite. After our 17-year-old friend and I wrote that song, I said, do you have an iPhone? Great, you have GarageBand already. Do you have an iPad? This is what I did. This is what I have. I give them Amazon lists all the time of these are instruments I've used in your session. Go get it. If you have questions, here's my email. I also have some instruments I can give to kids to take home with them. We get donations all the time. If an instrument is not something that I'm able to use in a room, like maybe it's a unvarnished wooden xylophone. I can't bring that in because I can't clean it. So I can give it away to someone who might be able to use it at home better than I will in the hospital. Or an egg shaker. We have so many that I'm able to give some away to some kids who really need that sensory stimulation to cope with a poke when they're in clinic, something like that. It might also be heartbeat recordings or recording projects that we've talked about, things that we've done here that then they take home and remember when they did it and use as a coping skill moving forward. I also love to connect with outside organizations. So maybe they're not music therapy organizations, but they're people who can offer music-based coping skills or non-music-based coping skills so that while they don't have me every day, they have someone that can support them. Have y'all heard of the Ukulele Kids Club?
No.
Yay, this is one of my favorite organizations. They have a team of music therapists that work with them, but their primary goal is to donate ukuleles to children's hospitals that we can then give to families. And if you Google them, their website is fantastic. They have amazing chord sheets. They have like a whole resource portal that I just give to families once I give them a ukulele. Because a lot of times learning an instrument is a great journey that we all know, we've all learned instruments. It's a wonderful journey, and I love to get kids started on it, and a ukulele is really approachable. So I can set them up with their own ukulele here at the hospital, and I'll give them all the resources for the Ukulele Kids Club. And then they bring that ukulele to clinic, they bring it to their inpatient stays, we continue to learn, they continue to learn outside, and it's a wonderful connection. Other organizations that are a little bit more local, Changed by Fire and the AZ Burn Foundation are both burn foundations that I'm working with that actually I need your help with, which is why they have asterisks. But they offer music therapy camps and other therapeutic arts camps around. So I like to connect people with them if they qualify for their services. So great segue. Do you want to help burn survivors and their families use music after their hospitalization? I need some students' helps. I have 2 burn camps that I am helping facilitate. These are not connected to Phoenix Children's in any other way other than the fact that I'm helping do them and I work there, but they're not connected to PCH. But we're providing music therapy in group and individual experiences, as well as education and take-home projects. Because it's a one-day camp, I'm trying to give them ways to use music after this as well. We're working alongside other professionals, psychologists, art therapy, equine wellness people, and social workers, and a lot of other people will be there as well. Would you like to help? We kind of, Professor Haimline, is it Haimline? Am I saying that correctly?
Hameline.
I'm so sorry, Mrs. Haimline. We decided that this could be for seniors and second-year grad students, and if we continue to do more, we could open up to more people. But let me know if you're interested. Sent along a flyer as well that I can pull up in a second. Amazing. But email me. I would love to work with y'all, and I promise we will have fun. But that's a side note. Yes, that's kind of post-discharge as well. That's not a part of my job, but it's something I'm really passionate about, is giving people ways to use music when a music therapist isn't present, because we're not everywhere as much as we might wish we were. Okay, so things you might want to know if you're interested getting into pediatrics. It's a hard field to get into, although right now there's a lot of openings. So if you're graduating and finishing internship soon, you might be in luck, man. But networking and meeting medical music therapists, I think, is invaluable experience. They're everywhere. Anywhere a big hospital is, you're gonna find one. And there's very few of us, so we always like to talk to people. It could be at conference. There's always medical presentations. Go to those, meet with them, talk with them. Within our state org and our regional org, talk with them. Talk to Piper, who I know is a big part of the AZMTA, where Cindy and I are here. There's also music therapy podcasts or social media sites or websites that are super duper helpful. Music Therapy Ed Now, I don't know if any of you know that Instagram. Yes, yes, fantastic. Definitely follow her. She's a music therapist at Wolfson's Children's. She's also one of my best friends. Good job, Danielle. Music Therapy Augmented, oh, don't do that. Music Therapy Augmented is run by a woman that works at St. Jude. Pediatric Music Therapy is also St. Jude. Some podcasts that are really good. Music Till Proven Therapy is the 2 pediatric therapists at Wolfson Children's. Music for Kiddos, Stephanie is just amazing, and you're gonna learn great things from her. Voices of Music Therapy is amazing. I think he works in hospice. When you're trying to get a job in the hospital, I think there's this like mythos that like you need to have hospital experience. Yes, like we would like that, I think a lot. Experience is the big thing. You don't necessarily need to have medical hospital music therapy experience to be a hospital music therapist. You need to have a experience in the hospital. You can always volunteer at hospitals, and that's how you get your experience. You can always try to do a practicum or an internship there, and that's awesome, but you do not have to have worked in a hospital to be hired by a hospital, if that makes sense. And also diversifying your experience is very, very helpful. My prior job was with mostly autistic teens. That is not who I work with every day, but my understanding of sensory integration and how to de-escalate and how to communicate differently based on people's strengths is something that's super helpful here. And and finding ways to continue your training. If you know you want to work in the NICU, you don't have to wait till you're in the NICU to get your NICU training. If you know you want to work in an inpatient rehab, you do not have to wait to get your NMT training if that's something you're interested in. If you know you want to work, I mean, I think guided imagery and music is a great training. So if this is something you want to do, why wait? You don't have to wait till you're actually working there to do it. And it might give you a bit of a leg up if you're interviewing and you're like, I want to work in the NICU. Also, I'm already certified. Yay. So just something to remember. Yes, does that make sense? Kind of. Yeah, okay. What questions do you have that I might be able to answer?
I have a question. Don't know if you have an answer.
I can try.
So I'm really interested in doing NICU music therapy, and I've looked at certification, and they've just started doing certification where they offer like once a year online training.
Yeah.
And you have to do clinical hours, obviously, in the NICU. Do you know if you like have to go out to Florida to do that training, or if it's with a local NICU MT?
That's a good question, because it used to be before online trainings, you had to be there. I would imagine this is the Jane Stanley training, correct? I imagine you have to go to Florida for those clinicals, just understanding that training, but I might be wrong. That would be something I would email her about, because I think she would get back to you pretty quickly. Yeah.
Good to know.
Yeah, totally. Just because I think her training is so specified and she gives so much of the training herself, or like people right under her give the training. So I would imagine you go there, but yeah. Anything else about being a music therapist, about working at a hospital, about burn camps? I forgot. I need your help still.
I always feel like I have a million questions because my goal is Children's Hospital. What would you say, like any readings or anything that we can do as students or even while we're in internship? Because I think of all of us here, the only one who's not a senior is Mizuki. She's a junior. So all of us are preparing for internship and getting ready to graduate, and it's been a very frustrating process. So is there anything like that you would suggest as far as like where we want to go career-wise, any readings or any trainings that you're like, oh, do this beforehand instead of just kind of waiting and just cruising through?
Yeah, this seems counterintuitive, but my advice for anyone who's about to start internship is to, a couple weeks before it, take a break. Like your internship is going to be so intensive and you're going to learn so much so quickly that you might need, like, I know when I was prepping for mine, I was like, I'm going to read everything and I'm going to listen to all the podcasts and I'm going to watch all the videos and just be like so ready. And I did. And I kind of wish I had taken a month and stopped, like just stopped all the reading, stopped all the research, and just like prepped myself and slept. I would have slept so much if I had known. So I encourage you to rest first. If you feel like your body is just like, it won't let you rest and you're so excited to do it, there are some great books coming out right now about intersectionality within the music therapy field. There's a great one. I gotta think of the name. Who runs the Slippery Rock Music Therapy grad program? Sue Hadley, found it. Okay, Sue Hadley just released a book and it is amazing. It is all about different music therapists and their experience in the field. And I think that is wonderful to read about, especially as we're a mostly white female field. Understanding other people's perspective is something that I am always striving to do. Really recommend that one. Yeah.
Name of the book?
Yeah, what's the title?
Great question. Let me Google real quick.
Yeah, because I'm not sure I'd even get her name. I mean, Sue.
Sue Hadley book. She has so many. What is it happening? Sue Hadley author. Will that pop up?
Is it Hadley or
Is it Representation Matters, but it is not enough?
Maybe. That sounds about right.
That one was published in June of last year.
Yes, that sounds exactly right. And Jocelyn, I can send you an email with like a link to it after this if I find it, when I find it. But yes, I recommend that one. Reading books that aren't a part of your direct curriculum. So I don't know what books your professors have you reading, but I enjoyed like just this, I enjoy novel like stories about music therapists from real music therapists, how they used it, what they would have changed. There's a great book on improvisation. Any book on improvisation, if you're wanting to go into that kind of field of study where you're music centered or you're humanistic, I think is really important. But also just rest. Really, I really think that's important. Yeah. Also, music therapists are really they want to be helpful. So if you want to send them an email and be like, hey, I'm about to start my internship, I'm really interested in what you did in this one thing, I'm sure they would love to talk to you. Yeah. Sorry, I know that probably wasn't super helpful, my vague answers.
No, that was good.
Thanks. Anything else you got?
I think I don't have questions rolling around in my brain.
That's fair. Are many of you trying to go into pediatrics? Is that the end goal for?
There are a bunch of us. At least I know you and me.
Yeah, for sure. Me in the room and Sarah over there.
Awesome.
We for sure really want pediatrics. I know a couple of other people have expressed interest into it. I like from day one was like, I'm doing NICU, I'm doing peds, I want to work in the children's hospital. That's what I want. So that's the goal, hopefully.
Totally. I will say often I feel like a lot of people don't think this is their path until they have an experience. Like I thought I was adult psych all the way forever. I was convinced. And then I did a peds rotation and I was like, oh, gosh darn it.
I'm
It's still in my heart. Yeah.
like, yeah, well, not with pediatrics, but you know, I was very solid. This is what I'm gonna do, and now all of a sudden I'm like, oh, maybe not.
Actually,
Like, this other thing is really good too.
I get it. And it's hard, and you don't have to pigeonhole yourself. I think a lot of us identify with our population, like I am a pediatric music therapist or I am a hospice music therapist. But I encourage y'all to not let that happen and be open to whatever comes your way, because you won't always be able to work in your first, like what you think you're going to do forever from the start. So be kind to yourself. Also, your life isn't music therapy. Just a reminder.
What?
I know. A person. I started changing my language recently from not saying I am a music therapist to saying I work as a music therapist. And you're not a music therapy student. You're just studying music therapy, and that's okay. Right now. Okay. It's cool to meet y'all.
meet you
Yeah,
too.
for taking this time, yeah.
Of course. You can here. Do you need my email? If any of y'all want to email me, you're always welcome to. Jocelyn knows that I answer very infrequently, and I'm so sorry.
It kind of comes with the gig. I feel like.
This is my email. Feel free to ask questions. If you need anything, let me know. If you're a senior or a second year grad student and you want to help me out, you can also email me. And we will make music together.
Sweet. What could we, I don't know, you probably do know the answer to this, but what would we expect if we volunteered on one of those dates? Like, would we be preparing interventions, or are we just showing up with guitars and just being like support staff? Like, what would we expect to do?
They're quite different, the 2 days. They're run by different organizations. The one that's coming up first, November 5th, that's their like title for the day is the Equine Day of Wellness. And I'm splitting my day in the morning. The art therapist is going to be there and run an experience. In the afternoon, it's going to be me and whoever wants to join me. And we are going to have a couple different things going on. We're going to be having a drum circle going on. We're also going to have a communicative, collaborative, like I've got a fill in the blank song that we're all going to make together. We're going to have some psychoeducational things. And then I'm open to whoever wants to come and help. If you have ideas, I would love them. And then we can kind of decide what works and what doesn't work and where your strengths lie. Maybe you love facilitating drum circles. Heck yeah, go do that. Maybe you're like, feel comfortable running something right now. Like this is a new population and I'm nervous, but that's okay. Do you want to stand by our table and help tell people who we are? Great. Do you want to help people write the song? Awesome. So it kind of is up to your strengths and where you lie. The one a little bit later in January is there's 2 groups that we're running for siblings of burn survivors and the burn survivors themselves. So that one is going to be more focused on active coping, especially with the siblings, about like how can we create a space where they can be the focus, because it's hard to be a sibling of someone who's undergone a medical trauma. So that's like a short answer, but it's gonna all depend on who wants to be there and what your strengths are. Yes, you will help actively.
Sweet. Always some good experience to that.
And I will sign any paper that says you did it if you need me to.
Put it on the resume. Boom.
There you go. Yeah.
Any more questions for her? All right. I think we're good here as long as you
Awesome.
got everything that you wanted to share.
Yeah. Feel free to spread that around. If no one emails me, Jocelyn, I might send you an email, be like, please push this one more time. I really need someone.
I will be emailing you for sure.
Yay.
Me.
Awesome. If you guys need anything, shoot me an email. That's about all. Thanks.
Cool. Thank you so much.
You're very sweet. Have a good one.
You too.
Bye.
All right. Let's see who's still on Zoom. All right. So I'll go ahead and end this Zoom